Hello again and welcome to the next topic. Here we're going to talk about a little introduction to evidence-based practice, principles and implications in nursing. First, we are going to start with some reflections. Please read the text of the slide. You can see here a recommendation of the U.S. Preventive Service Task Force that recommends biennial screening mammography for women aged 40 to 74 years. You can see here the recommendation is published in the online in JAMA in April 2024. Now think of the next question. What is the question behind this recommendation? What is this recommendation based on? What is the decision making? What is the certainty of this recommendation? To respond to all these questions, we can use a paradigm. This paradigm is called evidence-based practice and try to respond to clinical questions like we have shown in this example. And these clinical questions are oriented to different levels: health policies, institutions, units, or patients. And these paradigms help us to the clinical practice for making the best decisions. As I told you, this is the evidence-based practice that we're going to introduce in this topic. Let's go on with a little bit of history about evidence-based practice. You can see in this slide the names of the important figures in the field of evidence-based medicine. They are Dr. Archibald Cochrane, Dr. David Sackett, and Dr. Gordon Guyatt. These people the development the evidence-based medicine concept that emerged mainly in English-speaking countries, Canada, USA, and Great Britain. Together, these individuals have played pivotal roles in shaping the way medicine is practiced by emphasizing the importance of rigorous evidence in the decision-making process. Sackett and his colleagues show the need to not only teach methods to understand the literature, but also teach the application of new information to the physicians at the bedside. Evidence-based medicine appeared in the literature in the late 90s. The concept of evidence-based medicine, as the term was initially coined, emerged at the same time as a major development in clinical epidemiology, particularly in the use of epidemiological research methods. Above all, it was observed that on many occasions, clinical practice was updated and did not apply the most recent scientific knowledge that had been sufficiently shown to benefit the patient. In other words, there was what has been called a research practice gap. You can see in this slide the definition of evidence-based medicine made by Sackett in 1996 and published in the British Medical Journal. The definition is the consensus, explicit and judicious use of current best evidence in making decisions about individual patient care. The practice of evidence-based medicine means integrating individual clinical expertise with the best available external clinical evidence from systematic research. Years after, in the second half of the 90s, the concept of evidence-based medicine has been developing in other health fields like nursing, midwifery, physiotherapy, public health. In the year 2000, Sackett and colleagues used the term evidence-based practice, and the EVP was defined as the integration of best research evidence with clinical expertise and patient values to achieve optimal clinical outcomes. Nursing, like other scientific disciplines involved in healthcare, must adapt to the new demands of care recipients in the context of global social changes. In recent years, more and more emphasis has been placed on providing patient-centered care, which is based on the best available evidence and on improving clinical practice. According to research studies, evidence-based practice provides the necessary mechanisms to deliver quality and safe care compared with the traditional approach to care, thus enhancing professional satisfaction and patients' health outcomes and reducing costs. Observe the image and explore the various approaches nurses take to address new situations of uncertainty. It's necessary to realize that the tendency to provide care based on customs, routines, and the views of experienced nurses still dominates nursing practice. Such care can be a potential danger to improving and individualizing care. Nurses should be capable of implementing new findings and conclusions from research. Only then can they minimize the risk of harming the patient by the application of outdated and ineffective procedures. In the upcoming presentations, we will explore what EVP is and its process to provide you with some tools to help you approach this paradigm. See you in the next presentation.